Let's spend a couple of minutes talking torque. What's it really all about? Well, let's begin with the definition. Torque, moment or moment of force, is the tendency of a force to rotate an object about an axis, fulcrum or pivot. Just as a force is a push or a pull, a torque can be thought of as a twist to an object. Mathematically, torque is defined as the cross product of force and the lever arm distance, which tends to produce the rotation. Loosely speaking, torque is a measure of the turning force on an object such as a bolt or a flywheel. For example, pushing or pulling the handle of a wrench connected to a nut or bolt produces a torque, turning force, that loosens or tightens the nut or bolt. And that's what we do in our implant dentistry to the abutment screw. But why do we bother? When we torque an abutment screw to the manufacturer's predetermined value, we produce a clamping force between the abutment and the implant. It holds them together. The torque value is determined by the physical characteristics of the screw material, and the clamping force resists the occlusal forces. If the occlusal forces exceed the clamping force, then the abutment screw will loosen. Simple. And how do we do it? With a torque wrench, of course, not a ratchet. Now, let's look at torquing in action. And note the artery forces providing counter torque, because we don't really want to torque the abutment in the bone, we just want to torque the abutment screw within the implant. And this torque wrench breaks at 20 Newton centimeters.